Hello and welcome. We are here live with another edition of our COVID-19 updates here for Berrien County. My name is Jillian Conrad. I am with the Berrien County Health Department, and I am joined today by Nicki Britten, also with the Berrien County Health Department, and Dr. Loren Hamel with Spectrum Health Lakeland. Thank you both so much for being here with me today. And we are happy to provide these updates for our community on all things COVID-19 happening around Berrien County. So we'll get right on into it right away here. Just to start off, Dr. Hamel, we'll go straight to you. We know that the CDC just recently announced within the last week some pretty exciting news, new guidance for fully vaccinated people regarding whether they can wear masks or should wear masks anymore, as well as social distancing. Can you explain some of these changes for us?
Well, I sure can. I hope I can. We've been longing for the time where enough folks have been vaccinated, that we knew it was effective, that the prevalence of disease within our communities, and of course the number of admissions we had in our hospitals was low enough and safe enough to say we can start returning a little bit more to where life used to be. Those conditions are now appearing to occur in most places in the country. And the CDC, as of this week, said if you're fully vaccinated, you no longer need to wear a mask indoors or outdoors. And social distancing in most places is less important. Now, there are a couple cautions. There are still many workplaces that are indoors that are governed by, controlled by, if you will, MIOSHA regulations in the state of Michigan. And so it doesn't mean, everywhere indoors you can rip your mask off. Depends on where you work, depends on what you do at work, what kind of work you're doing, I should say. But it's really good news that we've moved toward a little more freedom when it comes to masks and social distancing for those that are vaccinated. Now, for those that aren't vaccinated and you're outdoors, it appears the risk of catching something outdoors is low enough, according to the most recent evidence, that it's okay to go without a mask. And I expect folks have been doing some of that anyway. I don't imagine that's changed everybody's behavior. Obviously, inherent in all of this is also a bit of, at least currently, a bit of an honor system. Those of us that are vaccinated don't have a V on our foreheads. Those that are not vaccinated don't have a sign that said, I chose not to have a vaccination. And so, there's some difference in these, the guidance, whether vaccinated or not. And, it's kind of based on, are we trusting each other? And are we trying to do the right thing to lower the risk for those that aren't vaccinated as well? So that's kind of the overview. Nicki, I bet you have a few things you could add to that, because you've been watching this very closely as well.
Yeah, Nicki, can you tell us more about what that's looking like here in Michigan?
Yeah, so, this is part of that messy middle that we've been talking about and predicting was going to come this spring, and we're smack dab in the middle of it some more. So the governor did announce last Friday morning that there would then be changes in Michigan epidemic orders in order to reflect that CDC guidance based in the research that Dr. Hamel was describing there. Epidemic orders came out over the weekend that did have that adjustment. And there really are some exceptions to indoor mask requirements, particularly for fully vaccinated people. There definitely are other rules at play, like MIOSHA. Some businesses might have their own plan. In some parts of the state and in parts of the country, there are local laws governing mask mandates. We do not have any local requirements for masking or public health orders for masking in Berrien County. But there are some other rules. So I know I've personally seen a lot of businesses that have said, you know what, during this time, we still would just like everybody to wear a mask. And some of it is, it's easier for the people who have not been vaccinated to continue to comply with that when there's just a culture of mask wearing. There's also this, some suggestions for families with school-age children or those under the age of 12 that either are not yet eligible for vaccination or the kids just haven't been vaccinated for whatever reason, that the parents in those families, when going out on a family outing, to still wear masks, to continue to create that model and that culture of it's okay for us to wear our masks. We're going to continue doing this. So that's part of the messy middleness. I think a lot of businesses right now, based on some of the technical assistance requests and questions we're getting at the health department, a lot of employers are really just trying to figure out what this means. MIOSHA is still in the process of updating their regulations to align with current epidemic orders. So right now, MIOSHA still requires employers to require all people to wear masks. So we're in this place where there's a little bit of incongruence. I expect over the next few days that will be resolved. There have been statements showing that as long as folks are showing a good faith effort to comply with the epidemic orders, there should not be any violations or citations from MIOSHA. But there's still some of the rules that need to catch up to the recommendation from the CDC that came out last Thursday, and it is in the works.
So probably a good rule of thumb for folks wondering is take your mask with you, have it handy, make sure you're bringing it with you in the car, taking it to work, wherever you're running errands. We do know that one of the settings and the circumstances where masks will continue to be required as recommended by the CDC is healthcare settings. Mm-hmm. Dr. Hamel, can you tell us more about what that will look like at Lakeland?
We're still wearing masks in the healthcare center setting, and we're requiring masks of visitors in the healthcare setting. We're working to be a little more liberal with visitation throughout this as well, but masks, at least for now, are going to remain important within healthcare. And it's probably useful for more than just COVID. We had one of the lightest flu seasons in history. And the reasons because everybody's wearing masks. So in fact, in a healthcare setting where we're up close and personal, we're taking care of people who are sick and immunocompromised, abundance of caution probably makes some sense. And so certainly for now, we'll continue wearing masks, and we're waiting the MIOSHA guidance and additional data related to healthcare. I'm guessing that over the course of this year, some of that may shift a little bit inside of healthcare, but for now we're wearing masks and we're requiring them.
So bottom line, masks are not gone forever. Still a good rule of thumb to bring one with you where you're going places. So shifting gears a little bit now, Nicki, can you give us some overview on what are the trends that we're seeing right now as far as numbers of new COVID cases go in our community?
Yeah, we're continuing to see really, really encouraging data. Case rates are continuing to decline. We are now at an average of below 20 cases per day being reported to us, which is phenomenal. These are levels we haven't seen since, early March. Last September, we were starting to see levels at about this much. So we're really grateful. We definitely made it through that March and April surge that the rest of the state went through. And we have continued to decline at the same time that the state is declining. Continue to be grateful that our peak was nowhere near as high as the state's peak. We came out of that relatively unscathed. We're also seeing our percent positivity decline, as you would expect with declining cases, percent positivity is declining. And we're seeing that really important decrease in hospitalizations too. So we did have that increase. We're coming back down. It looks like it's a sustained decrease for now. We're definitely going to be watching. There's a lot of science that's on our side saying that not wearing masks outdoors and vaccinated people going unmasked is certainly okay and should not have a huge hit on or impact on our cases. But we definitely all the more reason to encourage people who might be symptomatic to make sure you're staying home. If you're unvaccinated, continue to wear your mask so that we can continue to have this data driving in the direction we want it to be.
Dr. Hamel, can you give us an update on how things are looking there at the hospital?
Yeah, sure. We have an inpatient census of COVID positive patients drop to just below 20. Our case positivity is running around 7.5-ish. That predicts that we're going to continue with numbers in probably high teens here over the next several weeks. That is really encouraging. I would just like to remind people that the overall mortality of folks sick enough to be admitted to a hospital is still running a bit over 10%. That's a serious number. So if I have 20 in the hospital, I expect 2 of those not to go home to their family. And of course, that's serious and sad. And also, we still have about 46%, last I heard, Nikki, 46% of our population has had a first dose. Many of those had second doses, but at least a first dose. That's a good thing. We're grateful for that, but there's still a lot of vulnerable folks. I assume that most of us, maybe nearly all of us, but most of us, over the course of time will either have a vaccine or get the antibodies by getting sick. And if that's really slow over the next couple of years, healthcare is going to do just fine. But I want to make sure we're saving as many friends and neighbors' lives as possible. And when there's a mortality rate on the inpatient side of about 10 or 11%, in Berrien County, the overall mortality rate, as we've talked before, is a bit below 2% of all comers, running at 1.8% most recently. So it's much better. It's not over, and it's still lethal.
Yeah, certainly. So we know another piece of exciting news we did hear within this last week was that the FDA and the CDC did authorize the use of the Pfizer vaccine for adolescents down to the age of 12. What should parents know about getting their kids vaccinated if they're thinking about it?
Well, as you know, the number of children that have been COVID positive has increased dramatically. The number that have been admitted to the hospital has increased very significantly in Michigan. We've had even COVID positive babies in the hospital. Fortunately, they don't have the mortality rate as their grandparents do, but it's still a significant illness. So I'm grateful that we now are able to give immunizations to younger patients. As you know, there are a couple thousand in the study of children between the ages of 12 and 15. Those that were vaccinated had 0% after a couple months of getting COVID positive, and those that had not had the vaccine, there were 16 that got sick. So it appears to be very effective in children. It is very safe in children, no unusual side effects. Some of them get a little achy or low-grade fever like you would with a flu shot. Remember, the Pfizer vaccine is a messenger RNA vaccine. It does not get embedded into your genes. It does not interfere with fertility. There are other messenger RNA vaccines, and those have been well studied over decades. And so we think it's safe and effective, and encourage folks to consider that for their youth, age 12 to 15.
So we know that kids can get sick with COVID, and it's definitely a good idea that they get vaccinated. Nicki, can you tell us more about here in Berrien County, where could parents get their adolescents as young as 12 that vaccine?
Yes, so it's only the Pfizer vaccine at this point that is approved for anybody under the age of 18. So the 12 to 18-year-olds need a Pfizer. The Berrien County Health Department, we have Pfizer vaccine. We held a clinic yesterday and did a few hundred youth between the ages of 12 and 15. So it was great that we saw that. We do have another clinic next Wednesday, May 26th, happening at the health department. There are appointment slots available. You can go to our website and figure that out, or walk-ins are welcome as well. Spectrum Health Lakeland also does carry the Pfizer vaccine, as does Meyer and Walgreens. So there are places around if you are looking to have your child vaccinated. You can call any of those places, go on the websites, try to get some appointments. Just make sure that you're getting an appointment for a Pfizer vaccine.
And a good note for parents to remember that parental or guardian consent is required for those adolescents to receive that vaccine. So now that we know even more of our population can get vaccinated, what is it looking like for our vaccine efforts here? Are we done with mass vaccination clinics? What are the next couple of weeks or months looking like, Nicki?
So we definitely have been at a point over the last few weeks where the strategy for vaccination has really been shifting. It may not look that different to residents, but how we are strategizing for that and what we're trying to do has definitely been shifting. We have moved through and really saturated the demand, gotten to all of the people who were very eager and excited and very willing to go out of their way to get a vaccine because it was that important to them. But we also know there are a lot of people out there who are very willing to get the vaccine. They just haven't found a good time to do it. They might be worried that they would get side effects. It's worth noting not everybody gets side effects from the vaccine, so you don't have to assume it's going to be a miserable experience the next day. Many side effects are also mild and don't necessarily impact your daily activities, even though that is a possibility. But we know that there are a lot of people who are really just looking for a place close to where they live or work, or maybe for a clinic that's in the evenings or on the weekends because they work during the day and can't get away from work. So we're really working to make sure that we have more of those opportunities. Together with Spectrum Health Lakeland, we're really trying to make sure we have the vaccine available in convenient locations at convenient times, and that we have the ability to really talk with people and have some dialogue about what those concerns might be. You may have concerns, but maybe hearing from Dr. Hamel and I in this venue, maybe that's not helping to allay any of your concerns or answer your specific questions. So we're working to create more of those opportunities for people to have those conversations and then also get a vaccine in a convenient time and place.
That's great. So definitely less important about where you get the vaccine, but very important that you do get it eventually, especially if you are interested in getting it. So Dr. Hamel, one common myth that we hear a lot is if I've already had COVID, I don't need to get the vaccine. I've got the antibodies. What do you have to say in response to that?
Yeah, there's evidence that not everybody that gets the disease makes an antibody that's going to hang around long enough to prevent reinfection. And that may occur with the vaccine. We may need boosters with the vaccine in a year or more. I mean, that's being investigated. But the best evidence at this point is, and by the way, there are a number of folks that have gotten the disease twice and even died the second round. So, you know, those durable antibodies are not guaranteed, even if you get sick. So the recommendation is, if you've had the COVID disease, still get a vaccine. And you don't have to wait. You can do it anytime. If you've been treated during that illness with monoclonal antibodies or convalescent plasma, then you ought to wait 90 days. But if you haven't had either of those, you can get vaccinated with any vaccine as soon as you recover.
All right, well then there you have it, folks. If you've had COVID, we still recommend you get that vaccine, and you don't need to wait. Once you've made it past that isolation period, you are free to get that vaccine and mount that immune response that will be more lasting. So Nicki, shifting gears a little bit, we know that we here in Berrien County border with the state of Indiana. Folks might have gone out of state to get their COVID-19 vaccine, but we definitely want them, if they live in Berrien County or live in Michigan rather, to count towards our goal of reaching 70% of our population getting that vaccine. So if folks got their vaccination elsewhere, how could we make sure that they count towards Michigan's numbers?
Yeah, and there are ways to do that. So if you did get vaccinated in another state, you can bring your card, your documentation. Everybody gets a vaccine card. You can bring that to your primary care provider or to the health department, and we can get that entered into MICR, which is the name of the registry here in the state of Michigan. At the state level, there are efforts happening so that the different states in the Midwest, all of their vaccine registries talk to one another. Right now, if you got a vaccine in Indiana, it will get reported in the Indiana system, not necessarily the Michigan system. There are efforts underway to connect those systems, but the technology is just going to take a while to develop. So by the end of the year, that might be in place. But right now, yes, bring it to the health department or to your primary care physician. And it's important too, it's good to have your medical record just accurately reflect that, so that if you do need to go to the emergency room or you're establishing care with a physician, it's good to have that vaccine reflected. So in addition to counting towards our numbers, it's good that your record is complete. Similarly, along the same vein, there are some people who were maybe vaccinated in the state of Michigan, but have lost their card and they no longer have that proof. Right now, there aren't a ton of places other than public transit that are requiring proof of immunization, but that may change over time, and it's good for you to have that. So if you have lost your vaccination record card and you need proof of that vaccination, you can also request that through the health department, and we can do a printout from the immunization registry for you.
Really good information. Thank you for sharing that. Well, that kind of wraps up the main questions that we wanted to cover today. Dr. Hamel, any closing thoughts before we end?
Yeah, thanks so much. So if you've joined us today, it means that you want to stay well informed and that you care about your health and the health of your friends and family. Thank you for that. You've been part of helping to win the battle against this disease. So thanks so much. If you've not decided to have a vaccine, please talk with us about any concerns that you have. We're happy to do that with you anytime. Health department, your physician, call Lakeland. We'll put you in touch with somebody that will have that conversation. Third, if you've had the vaccine and you're surrounded by some folks that haven't, the data is really clear on this. You can't shame and blame your way into changing somebody's mind or heart. You can do that with information, with love and respect, with kindness, by listening. So do the best to influence those around you, help nudge them into behaviors that we think are life-saving, things that are going to keep them safer and others safer around them. So if you can be helpful with that, we really appreciate it. And lastly, stay tuned, because this is a moving target right now. We're getting movement across the country. There's going to be a response to that. Are we going to see little upticks in COVID? Maybe. Will everything be better in 2 weeks or 3 weeks? Maybe. So stay tuned and we'll keep you informed.
Nicki, any closing thoughts?
I mean, I couldn't say it better. I guess the thing that I would add is just to remember that our mitigation measures, they're dials. And right now we're really enjoying the fact that there's more opportunity to not have to think about social distancing and masking in every single setting. And that is a great thing as we're getting into warmer weather. But just know there could be a time where we may need to dial it up again for a brief period of time. We hope that doesn't happen. We hope that things continue in the trends that they are. But let's enjoy what we have right now.
Wonderful. Thank you both so much for these important updates. And thank you for joining us today on Facebook, whether you're watching live or catching the replay. Stay tuned with us, as there is surely more information to come, and we will certainly bring you all of those updates as we are able. You can check out all of this information on the Spectrum Health Lakeland website, as well as the Berrien County Health Department website. We encourage you to learn more there if you are able to. Thank you again for joining us.